Hi guys, it is Dr. Shelley. It is October 8th, 2021, Friday. And so, yes, I am coming to you live, as I have been doing every single Friday since the beginning of COVID. But this is October. This is Breast Cancer Awareness Month. We are actually seeing some improvement in our COVID numbers. And so, we're going to divvy off a little bit and kind of talk a little bit more about breast cancer and breast cancer awareness for for October. And I will also glance on the COVID information as well. But I just felt like I need a breather, and it's time to kind of give a little bit more information on some other things that affect our health significantly as well, and also give you guys the data on the COVID numbers as well. And we can do that a little bit later in. I am Dr. Shelley Coleman Glover. I am a board certified gynecologist. I specialize in anti-aging, wellness, and bioidentical hormonal therapy. My office is located in Central Florida in Claremont, which is a suburb of Orlando, or like I like to call it, the House of the Mouse. And I have a master's in public health as well in maternal and child health. And I am happy to be coming to you live today to talk to you, like I said, about October and the things that are um, uh, relevant to it as far as our health is concerned. So, the big thing that most of us are aware of is that October is Breast Cancer Awareness Month. And so that's what we're going to touch on today. But also, if you don't know, this is also a National Cyberspace Month, which I learned about, and I don't know enough about cyberspace to tell you uh, 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 anything about that, so I'm going to leave that alone. But cyberspace safety month, and also, but it's also Domestic Violence Month, and that is obviously extremely important. So we will be discussing that next week, and so we will. I'm going to try to kind of touch on both things throughout this month for you guys. Okay, the as well, I'm in Florida, so the Floridians know our governor's first lady is dealing with breast cancer currently, as are many, many women throughout the United States and throughout the world. We have and so October is the month where we just try to bring attention to what is going on with breast cancer, because it's important. And like I said, if you don't know, every month has different health initiatives that are linked with it. So October, like I said, is for breast cancer awareness and for domestic violence. So what is breast cancer? So, as soon as we hear the word cancer, everyone, and including me, if it was being used in towards me, would be, you're just petrified. It's scary. We all know someone that's died of cancer, and we get this feeling of helplessness and not being in control, and we really don't understand it. A lot of people, so it's kind of like, oh, what do I do? And so a lot of times when I have to tell somebody that they have breast cancer, they don't even hear anything else after that word is said. It's just like, kind of like, that's why it's always important to have somebody else with you when you're going through cancer diagnosis and discussions, because a lot of it just gets lost because of the overwhelming fear of cancer. Um, Cancer is basically every cell in our body is able to grow. We have cells that are constantly growing, and then they also will die. And so there's a conversion of cells in our body at all times in different organs in our body, and some at different parts in our lives grow faster than other times. So the way to think of a cancer cell is that it is growing and nothing is stopping it. So normally there's stop gaps and say, okay, we're going to grow a certain amount, and then you're going to stop, and then you're going to die, and then your new cell's going to form. And so with cancer, it's like it's missing that signal, and so it just keeps growing and growing and growing, and so it forms a mass or a tumor. Now, there are benign tumors, which means non-cancerous, but when we're talking about actual cancer, we are talking about what we call a malignant tumor, or a cancerous tumor. And that throws people off too. So try to keep those separated. Just because someone tells you you have a tumor, it doesn't mean that it's cancer. We deal with a lot in GYN. We use the term for, especially when we're talking about fibroids. You may hear someone say they have a fibroid tumor. That does not mean that it is cancer, or a polyp. And people assume that if you have a polyp, that it's got to be a precancerous polyp or a cancerous polyp, and that's not true. But anyway, I digress. So that's what cancer is. Just think of it as um, uninhibited growth that's just kind of gone off, and it's not following the normal signals that a normal cell in the body should follow. And and obviously in the case of breast cancer, this is occurring in the breast. It can occur obviously in the liver, it's occurring in the liver, and if it's brain cancer, it's occurring in the brain. So this can occur anywhere in the body. But yes, there are certain cancers that are more common, certain types of cancer that are more common in certain parts of the body. And so right now, like I said, we're going to hone in on breast cancer. And the breast itself is made up of both ducts, which is just what they sound like, ducts. So they're little uh, what do you call it, tubes that separate and transport, so they can transport secretions. And obviously when a woman is breastfeeding, they're transporting milk. The lobules are basically little sacs, and when a woman is um, breastfeeding or pregnant, they will fill with milk, and then and then the ducts are what take the milk to the nipple, so that it can come out from there. Also, there is fat in the breast, and then behind the breast we have the breast wall, which also has muscle in it as well. So there's different levels, and one of the reasons why we don't we don't do mammograms too early on in young women is because they have very dense breasts, which are more lobulated than they are fat, and it's just really hard to see anything, and so you're not going to get a good yield when you get the mammogram done. The Because we do get young people that want to get a mammogram, and that's why the recommendation is usually starting at age 35 and going forward from there. The 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 majority of breast cancers do occur in the ducts. You may hear the word intraductal cancer, and that's what we're talking about. That it's actually in the ducts. But then you have 5 to 15% that are in the lobes. The 1 in 8 women, the statistics are, will be diagnosed with breast cancer at some point in their life, and that equates to about 13% risk throughout the lifetime. We have in the United States, we have over 4 million women, or close to 4 million. I think the number is actually 3.8 million women who are either actively dealing with breast cancer or are breast cancer survivors. It is actually breast cancer is the most common cancer in the world, and it's also in the United States. It's the most common female cancer. Now, with 30% of new cancer cases in women being diagnosed, those are breast cancers. So it's definitely is, a lot of people think, well, why does breast cancer get so much attention, more so than, say, some other cancers? That's why, because it is extremely prevalent. And to put things in perspective, 1 in 2 women die of heart attack and stroke. 1 in 8 women are going to be diagnosed with breast cancer. So it's up there compared to like a lot of other diseases that may have a much lower yield. Now, the good thing is that just because you get diagnosed with breast cancer, that doesn't mean that you're going to die of it. We still, in this 2021, it's expected that 43,600 women will die of breast cancer. Now, that's a lot of women, but when we put things in perspective compared to COVID, obviously, we dealt with, we've had over 353,000 people die of COVID this year. And also, when we look at actual diagnosis of women, they're projecting there's going to be 281 thousand new cases. So 281,000 new cases of breast cancer diagnosed, but for what did I just tell you, 43,000 women that will die. So definitely for every single one of those 43,000 women and their families, it is definitely devastating. And I'm not belittling that number, but just trying to put things in perspective, because when we do see women and they are diagnosed with breast cancer, they kind of, the first thought process is that they're going to die of it. And I have to remind my female patients that no, that thank God the majority of our breast cancer patients are survivors, and that's the goal, right? I always tell people my motto is early detection, early treatment, early cure. That's what we want. We can't undo if you get breast cancer, but we can certainly try to make it so that it is something that does not rule your life, that you're able to hopefully um, get control over it and become a breast cancer survivor. The uh, the 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 incidence of breast cancer has actually it's been kind of interesting. The numbers were actually going up, 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 as in the 1980s, 90s, in the 1990s. They did have a significant drop down in the early 2000s, and some of that was thought to be because of one of the WHI hormone study was one of the things that they thought was accounting for that. Also, new technology and so improving diagnosis of breast cancer at an earlier age, and also new treatments. Now, the numbers decreased significantly all the way down until about 2018, so about what 3 years ago, and now it's been just slightly increasing, very very small, 0.5% per year, but there's been a slight increase in the number of breast cancers in the last couple of years. So keeping an eye on that, and obviously they're looking to see what can be done to either stabilize or reverse that. The and when I talk about the when I was I'm sorry, what I was just talking about was mentioning was I was talking about the actual death rate in women has decreased significantly, and that's primarily in women over the age 50. In premenopausal women, it's been holding steady since about 2007. So it's not getting better, it's not getting worse. Luckily, most breast cancers are in women over the age menopausal. So not ideally, but usually over the age of 50. Um, uh, Ethnicity. So who gets it? And it's interesting because um, the thought process a lot of women have is that it's more common in Caucasian women and it's very uncommon in African American women. And that's not true. Yes, it is more common in um, um, Caucasian women, but actually the statistics are not that far off. The risk, lifetime risk in Caucasian women is 13% over their lifetime. In African American women, it's 12%. So I was actually surprised when I looked at the data most recently because I thought it was a little bit lower than that myself. And so, it's really not that far when you look at it. Hold on, where's that data? It's like one what? I can't find my data, guys. Where is it? There you go. Oh, here it is. So there were 124 um, uh, thousand cases of new cases of breast cancer per 124, excuse me, 124 new cases of breast cancer per 100,000 women and Black women, 131 in white women. So we're not talking a huge difference. So yes, it is higher because this is per 1,000 women, 100,000 women, but still, we're talking about 131 versus 124. So it's not this huge schism that a lot of people think. Because, like I said, when I talk to African American women, a lot of them think that they have a markedly lower risk and that it's not something that they have to really worry about significantly. Also, we do know that when we talk about premenopausal breast cancer, so usually a breast cancer is occurring, obviously, in someone that has not gone through the change of the life. So normally the data looks at under age 45. It is actually higher in African American women. And when African American women get breast cancer, they're actually more likely to die of it. So even though they may not be quite as high, it is definitely a very, very serious disease in the African American community. As far as the breakdown following that, the third most common group is Asian, then followed by Hispanic and Native Americans and Alaskans are actually very lucky. They have their rate is markedly lower. So whatever they're doing, we should all be doing. But they're down. Their number is 81 per 100,000 compared to, like I said, in Caucasians where it's 131 per 100,000. So it's almost double. So they're definitely doing something we're not doing as far as where it comes to the breast cancer incidence. The highest group within Caucasian women is the Ashkenazi Jewish population. That's primarily due to genetics. However, that's another myth that a lot of people have. They think, okay, well, it doesn't run in my family, so I don't have to worry about breast cancer. Only about 10 to 15% of breast cancers, about 15%, are familial. Where they're running in the family. And that means you have a first degree relative, whether it's your mom, your sister, um, uh, or like so the main is mom, sister, or daughter, but it can also be like first cousin, or grandmother. That's usually considered right in there, but your first degree is actually 1 degree away. And so that's about 15%. And then as far as when you have the genetic mutations that you hear people talking about, you may have heard of BRCA1, BRCA2. So yes, if you have those, you're at a much, much, much higher risk, but that's actually extremely rare. I can tell you we do a lot of BRCA testing in our, well, I wouldn't say a lot, but we do a significant amount of BRCA testing in our office, and it's extremely rare that we actually have someone come out positive, which is it was a blessing. We certainly don't want people to be positive. Now, if you do look at and so only about 5 to 10% of actually breast cancers have a genetic mutation, and that's what we're talking about when we're talking about the BRCAs. And there are other ones besides BRCA1 and BRCA2, but we're not going to get too detailed today. So if you do have a family history, your risk does double. So definitely it is important to pay attention if you do have an immediate family member that has breast cancer. And even if you do test negative for the BRCA gene. Now, if you have the BRCA gene, if you have BRCA1, your incidence over your lifetime of having breast cancer diagnosis is 72%. And if you have BRCA2, it's 69%. So definitely, we do have conversations with our BRCA positive patients about what to do regarding breast cancer through their life based on where they are in childbearing and how old they are. The As far as risk factors that go along with breast cancer, so we all know age. The older you get, actually, the higher your risk. That is something I like to kind of point out, because sometimes I will get people and they will say, well, I did my mammograms every year between 40 and 50, so I'm going to back off now because I haven't had any problems. Well, no, just the opposite. The older you get, actually, the higher your risk. So we do not back off of our mammograms. If anything, we go even, it's even more important that you get your mammograms every year, and you do your breast exams every month, and you let your physician or practitioner lay hands on your breast every single year to try to catch things. Like I said, early detection, early treatment, and what? Early cure. So what other things that a lot of people don't know about? So we kind of know family history. We already talked about that. But like I said, that's like lower down as far as the gross number of breast cancer incidents. It's only 15% of all breast cancer cases. Obesity. So definitely weight is a problem. And it's not just a problem with getting diagnosed with breast cancer. It's also people that are obese are at a higher risk of a recurrent breast cancer. So definitely you hear people say you are what you eat. It really, really, really is true. And we learn more and more about that as we go. And that's, once again, we can delve more into that at a later time, because we can have a whole conversation on diet, and especially on the American diet, which is probably one of the worst diets that there is in the world, because we believe in supersizing everything, and the more fat, the merrier. Delayed childbearing, as you may or may not know, having a child under the age of 30 is actually decreases the risk for breast cancer. Now, I had my child at 37, so I'm not saying that that is a reason to run out and get pregnant, but just these are I'm just giving you guys the facts. The radiation. Now, don't get confused. People go, oh my God, I shouldn't get a mammogram because I'm scared of the radiation. No, 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 no. We're talking about radiation to treat a cancer. There are different cancers that young women can get. And so if you have radiation to your chest wall, if you have radiation to your face because of a cancer, then yes, that could lead to a higher risk of breast cancer. So I'm talking about for a non-breast cancer, then if you have that radiation, then yes, that does increase your risk for having cancer. Having any cancer increases your risk for having cancer. Your body's already broken, and it's already told us it's broken. And so whenever any cancer patient is always at a higher risk to get a recurrent, either a recurrent cancer or a new cancer somewhere else. Doesn't mean you're doomed, but that's just the way it is. The body's already shown us that it doesn't know how to necessarily handle that cell growth and breakdown, and it can do it again. It did it once, it can do it again. Smoking, especially in premenopausal women, actively smoking increases the risk. And then even in there's looking at some data is secondhand smoke, especially in the postmenopausal population. So heavy smoke, secondhand smoke. I'm not talking about you're out to dinner and you just happen to be, walk by somebody, or you're sitting there waiting to get seated and somebody's smoking near you. I'm talking about having somebody in your immediate household that is smoking significantly. You're exposed to it day in and day out. Um, the alcohol. Now, this is interesting because even in moderate um, levels, it is associated with an increase in breast cancer. So it's not, we're not talking about alcoholics. They're saying that even 3 drinks a week, and that could be all at once, that could be spread out over the week, then that actually does increase the risk for breast cancer over your lifetime by 15%. Okay. Um, and one of the things that if you've been watching me over the last year, you know that I am a big proponent of vitamin D. And as we've discussed over and over and over again, it is a huge immune booster. And it also seems to be by itself a significant hormone regulator. And so there's definite data that, as in many diseases, vitamin D, people that have high vitamin D levels have better behaving diseases. Well, cancer is definitely one of those, and breast cancer is definitely even more so one of those where vitamin D can play a vital role in improving outcome with breast cancer, both in boosting the immune system to keep you from getting a cancer, but then secondly, in having a better behaving cancer if you have one. So definitely, if you're not taking your vitamin D, because I've lectured you over and over again to do it for your immune system and to decrease your risk for COVID, you definitely should be. If you have concerns about breast cancer, it's just vitamin D is just wonderful. That's all I have to say. I mean, even it spans everything. Diabetics that have good vitamin D levels have a much better diabetes profile. So it works across all diseases and all cancers, but definitely is cited for breast. Diet, which takes us back to the obesity, but even people that are not obese, once again, this is something that's a little bit different. Even people that aren't obese or overweight, that eat trashy diets, there is an increased risk of cancer noted just based on diet, like you hear about all the trans fats, etc., over a lifetime. So increasing a risk of 30 to 40%. So, like I said, we are what we eat, right? Lack of exercise is definitely associated with it. Another thing that you may not know that's interesting is light exposure. So not just, of course, we hear all the controversy regarding the cell phones and having the blue light and having the cell phones next to you. And the recommendation is that you don't sleep with your cell phones near you and try to not have them on your body. Ladies, please, 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 you never want to be walking around and putting your cell phone in your bra. You also shouldn't have it sitting in your pocket all the time because, of course, your ovaries are down there, and guys too. It shouldn't be something that where this is really on your person at all times. Ideally, it's much better if you can have your cell phone either out and away from you, or in a purse or something like that. But what I found interesting is that it's not just that kind of light we're talking about. They're talking about, even like, say if you live in a city and you're got a lot, like a huge street light right outside your bedroom window, that kind of light at night, specifically at nighttime. So it's disrupting your sleep pattern, which also affects your melatonin. And we know that melatonin is also a natural substrate that the body makes, and melatonin increases your immune system by increasing your fighter T cell count. And so that all gets in there linked together. So I know a lot of people think it's all hogwash, but it's not. So if you do live in a city environment and you are looking and it's pretty lit in your bedroom at night, getting some dampening curtains would be something you may want to consider. The other thing, which isn't good for me as an OBGYN, but shift workers, so people especially in healthcare, but anybody that's working nighttime shifts and being exposed to light at night, they're saying that they actually have an increased risk compared to people that work daytime jobs. So there you go. But like I said, even though I'm telling you these things, it doesn't mean, like, if that's the job you have and you're a nighttime shift worker, no one's telling you just quit your job. Just giving you information. There are lots of things that cause all sorts of things that we do to ourselves every single day. I tell people we take our lives in our hands every time we get behind the wheel of a car, and we do it several times a day, most of us. And so you have to always take everything with a grain of salt. You can't just assume, like, go way off the deep end. As far as, you have to be able to live your life. But if there are simple things that you can do to make your life better and decrease your risk at the same time, why not? Um, Something that you may or may not have heard of, but just so that we're being thorough, DES exposure. DES was a medication that was given to women primarily in the 1940s, 50s, 60s, and it was given to them for morning sickness when they were pregnant, and so that's kind of, and so their kids were, so those women were at increased risk for breast cancer. And then it was a concern about their kids that were in utero when they were taking this medication, that they might be an increased risk as well for cancer. But that's pretty much, like I said, that hasn't been since the 60s. So we're going to start seeing that won't be as much of a factor. Like our 60s babies are now in their 50s now, so we'll see that start to peter out as we start as we move forward in our population. The other thing, exposure to chemicals, and once again, um, it's just amazing the more we know. And so there, and when we're talking about chemicals, we're talking about chemicals in many things. So there's chemicals in your water, there's chemicals in your foods, there's chemicals in obviously in our plastic. So you get into that whole the BPA, and when you and so hearing that the things are free of that. The hair products, sunscreens. You guys may have remembered earlier in the summer we were talking about the sunscreens, and how they had some of the recalls and stuff like that because of the chemicals. Cosmetics. I mean, it's just, there's chemicals, unfortunately, in a lot of things. And so what I would probably do is we can, like, maybe discuss that a little bit more in one of the follow-up Friday ones this month, and delve into that, because that's like a whole, once again, topic by itself. And then, of course, hormones. And I am a gynecologist. I specialize in bioidentical hormonal therapy. And there is a lot of concern, and there's a lot of varying information that you can get depending on the healthcare professional that you talk to. Most of our breast surgeons are very anti-hormone in their menopausal women, and that's because they see breast cancer, and and because of some studies that came out, like I said, the WHI studies particularly back in 2002. But that was only on one type of medication. And so there's a lot of other data out there on hormonal therapies, and there are a lot of hormonal therapies out there. So I tell my clients all the time, I say, when you look at the media, it makes it sound like if you get on hormones, you're going to drop dead, and if you don't, that you'll live to be 150, and it's just not true. Like I said, I deal with hormones all day long. I prescribe them all day long, and I have no increased risk of breast cancer in my patient population. And if anything, I would say that we actually see less breast cancer in our hormone users than our non-hormone users, maybe because we see them more often, and we actually are on top of them more, and we make sure they get their mammograms and all of that. But no, that would just actually improve the diagnosis. So that's not true. So basically, so I don't see it particularly in my practice. And we do, like I said, that's a whole other conversation that we can get into and really delve into the difference between different hormones and the risks that go along with breast cancer. There was, like I said, there was a significant decrease in breast cancer after the WHI study came out, which was done on Premarin and Prempro, which is just two types of synthetic um, uh, hormones that were being utilized in high quantities in that time frame. However, that decrease, so there was a significant decrease from 2002 to 2003, and then there was a slow trickle down decrease, but then everything is stabilized out. And so, and women have started to go back on hormones, not the Prempro and Premarin as much, but women have started to go back on hormones, and a lot of the data, like I said, can be has been wish-wash. So we will delve more into that in another time. Let's just touch on men real quick, because yes, a lot of people don't realize it, but men can get breast cancer. Luckily for them, it's extremely rare compared to their female counterparts, but you need to be aware of it. And the highest risk would be with our men who are BRCA2 positive. They don't really see BRCA1 in the men. And I'm not sure why, but that's the data. So we don't routinely walk around testing men for BRCA2. However, if you are a male, or if you are in a relationship with a male who has sister's mother, anybody that is BRCA 1 or 2 positive, that would be a big sign for them to go and actually have a conversation, and find out what their risks are and get evaluated. Okay. But I'm not saying that a random male should run around and try to get a genetic testing. Genetic testing is actually extremely expensive for people that don't know. So it's not something that's to be taken lightly, and you can't just walk in and ask for a genetic test. You have to actually meet several criteria beforehand. Men, the risk is in their whole lifetime is 1 in 833 men. And so that's to put things in perspective, like the 2018 data, there was uh, the new cases of breast cancer in men were 1.3 per 100,000, whereas in women in the same year is 129 per 100,000. So we're talking, much lower risk in men, and the death risk was 0.3 per 100,000 men versus 19.7, so almost 20 per 100,000 women. So definitely not a high risk group, but like I said, I do want to make sure that you are aware that it is possible for a male to get breast cancer, so that we do not assume that it is not. Um, and so that's kind of where I wanted to leave it, because, like I said, we can delve further into individual things, but I wanted to make you aware of it because this is Breast Cancer Awareness Month. And I am a big proponent on mammograms. And like I said, please, when you're thinking radiation, that is not what we should be thinking about. It's not, the radiation levels, in the 1970s, which is where the mammograms got a really bad rap. That's old data, but it still circulates around and around and around and around and around. And so we are exposed to radiation every single day of our lives. And when you get on a plane, watch out, because you're definitely being exposed to radiation. And we do it all the time. So the radiation from a mammogram is extremely low, and definitely the benefits far outweigh the risk. And so, yes, I am a big proponent on mammograms. People ask me all the time about thermograms, and what I will tell you is that thermograms, you may certainly do a thermogram if you want, but I have seen patients more than once with palpable breast cancer, diagnosed breast cancer, and negative thermograms. So, not to say that mammograms are 100%, but I would definitely not put my stock solely in a thermogram. The whole point of a test is to do something, is to have a test that's going to be able to yield you some information that you can use. So you can do a test all day long. If it doesn't give you the right results, then why are you doing the test? So that is my thought process on thermograms versus mammograms. Like I said, I'm not opposed to thermograms, but mammograms have the data. And like I said, I've been practicing for 20 years, and I've seen both, and I've dealt with cancer in my clients, and in myself personally, I can tell you, I will take a mammogram every day of the week before I would actually put all my faith into a thermogram. The uh, I recommend that you do examine your breast every single month, or get your partner to. They will enjoy it. And I don't care who does it, as long as they are serious about doing it and they actually do it on a regular basis. You can't, if you don't examine your breast on a routine basis, are you going to know when there's something different? No. And so it'll just scare the crap out of you, because breast can be lumpy, bumpy. So it's you got to get into that habit so you know what you're looking for. And then I do recommend that you actually get into your physician and you get a breast exam every single year as well, because the whole thing is to catch things. We can't necessarily stop you from getting breast cancer, but like I said, early detection early treatment, early cure. So if you are unfortunate and you actually get breast cancer, we want you to be a breast cancer survivor. So that's where I'm going to leave it with breast cancer. I'm going to go over quickly just some of the COVID data because that's what I normally do, and I didn't want to like suddenly just drop it completely like a hot potato on you guys, and you're like, wait a minute, I thought she was going to give me the COVID information. So the statistics for COVID, real quick, for this month. We are looking at, as far as cases overall worldwide, we're at 237 million cases and 4.85 million deaths. So almost 5 million people throughout the world have died of COVID. Within the United States, we're at 45 million cases and 730,000 people are dead from COVID. And so once again, looking at, like I just said, people are petrified of breast cancer, and rightfully so. But we're talking about 43,000 women dying of breast cancer versus 730,000 people having died of COVID since its inception. Also, the COVID numbers, more people have died of COVID in 2021 and we haven't even finished the year, than all the people that died of COVID in 2020. That's extremely concerning, especially since these are now senseless deaths overall, because the majority of the people that are dying are unvaccinated and there's a vaccine out there. So just food for thought, just so that you're aware that this is not, because a lot of people think, I mean, jokingly, we did an open house yesterday at our office, and we were, we're talking about it, and of course, people think we're crazy down here in Florida, and so I always say, we don't have COVID in Florida, but one of the other people there was like, "Isn't COVID gone?" It's not gone, and people are dying every single day. So do take it seriously, and if you think that it's over, it's not. We are luckily in Florida coming down off of our fourth wave, and we are very excited about that. Our numbers are significantly down. We're down actually in the hospitals 74%, which is humongous. And I had actually said that I thought the numbers were going to start to come back down when they started piking up in August. I had predicted that we were probably looking at October, November before we saw the surge come down. And luckily, it's actually been closer to the beginning of October. So that's a blessing. And that's allowed for us to be in full reopen as far as the hospitals. We're no longer, our surgeries are no longer being restricted. We can schedule our patients, and there's beds availability, there's ICU availability. And we're talking about Florida now. I'm not talking about other places because obviously, it's there are other states now that are in dire crisis. So it's going to be that wave effect that we've seen throughout. And as it gets colder, we're going to see that those numbers start to go up more in areas where people start to go inside. As someone said previously, our summer in Florida is everybody else's winter, meaning that in Florida it's so hot in the summer that everybody tends to be inside, whereas other places it's, people are outside. So in the case of a transmissible disease like COVID, you're going to see less numbers other places in the summer, but you might see higher numbers in the South and the Southwest because it's so bloody hot that we tend to be inside. So our numbers are starting to come down, also just because of treatments, and we have seen an increase in vaccination numbers, luckily in our state as well. The overall vaccination rate, though, is still kind of like, stagnant. If it's 6%, it's up to 56.6%. Worldwide, we're at 35%, and then we're talking about fully vaccinated. The breakdown within the United States: California has 4.67 million cases with 70,000 deaths, Texas 4.1 million with 67.3 thousand deaths, and Florida 3.64 million with 56.4 thousand deaths. New deaths over as of yesterday, it was 1,709 new deaths in California, 148, Texas, 245. Florida's numbers get a little screwy. You have to kind of, our numbers are just screwy. So basically, it says 2 deaths, but there was, you have to kind of look at the 7-day average on that because it will vacillate significantly. I did pull up some local data. As of Monday for Orange County, which is where I live, and that's where Orlando the city of Orlando is located within Orange County, Florida. The numbers as far as vaccines, 74% of people over the age of 12 in Orange County have had at least one vaccination, and the fully vaccinated 64%. they have the positivity rate is down to 7.5%, which is really good because our positivity rate was almost at almost double that a month ago. And but they've had 245 uh, no, excuse me, there have been over 2,045 deaths. But just to put things in perspective, even though we're seeing a significant decrease in the number of COVID cases um, in our hospitals and in our ICUs, 45 people died over the weekend in Orange County. So, and remember that that's because the death, we've gotten better at overall at treating COVID. So a lot of people end up in the hospital for extended periods of time. They're very, very ill, and then they die. And especially now that we have access to the hospitals and ICU, so we're not going to see as many people that are dying. In their homes, if they're willing to venture out, they can get to the hospital, they can get the treatments. But sometimes if it's too late, or just depending on how their body responds, then you will see the deaths coming later. So usually it's not 100%, but normally, you see about a 2 week lag, and in some cases, it can be like 3 to 4 week lag between when somebody's diagnosed and when they're actually dying. And not to say that they can't die at other times, but I'm talking about the normal curve that we see. The just so you know, there are three mobile testing trailers, and they can also give out. They actually are going around, and they're doing vaccinations. They're about to, I do believe, there's three testing sites currently, and one of those is uh, the Camp World Stadium. That's going to actually be closed because now they're going to start having events there. So if you're looking to get testing and or get vaccinations, go to the Orange County website. I do know Barnett Park is continuing to do both. The and their vaccinations with through Orange County will only be with Pfizer and Johnson & Johnson new vaccines. They're not giving out at this point new Moderna. But remember, you got CVS as well as Walgreens and Publix that also are giving out vaccines. The Oh, to touch on our because as you may or may not know, the FDA has, excuse me, Pfizer has put in to the FDA to seek for approval for vaccination from age 5 to 12. We've already got approval from 12 up. And so looking at that numbers, because of course that's very controversial, very concerning, very scary. If you have a young child, do I vaccinate them? Do I not vaccinate them? And there's a lot of, you know, um, concern on both sides. So just so we're clear, there are 645 children that have died in the United States from COVID. And yes, I mean, looking at our overall numbers, which are in the thousands, yes, that is not that many, but that's 645 lives that could have been prevented from something that can be prevented with a vaccine. So every child that's lost, we should not have to lose a child to something that we can actually prevent. And children make up 22% of the population in the United States. However, they make up 27% of COVID cases. So we actually have more children being diagnosed percentage wise with COVID than we actually have in our overall population. So for those people that think that's currently now. So we're seeing, like I said, this COVID is not stagnant. This is not the COVID-19 that we were dealing with in early 2020 is not the same. The Delta variant is a whole nother animal, and the longer we are allowed to keep this thing circulating, the more variants we will have, and things will morph, and we will have changes as to how we are dealing with it. So now currently 27% of new cases are in our children. And so that's more than our children, our percentage of children in the population. So it is now becoming a disease of our children. It's not like it was in the beginning when we were seeing it primarily in our elderly and then, trickling down from there. And only a third of kids in the 12 to 27 age group that are eligible for vaccines are actually vaccinated. So definitely there's concern that we're not going to see um, a lot of our 5 to 12s vaccinated when it's available. So hopefully that's not correct, but we will have to see. When they do polls, they say that there are about a third of people that are saying that they're not sure, a third that are saying that they will definitely do it, and about a third that are saying that they definitely will not. But those numbers obviously change all the time. The um, and so I think that, like I said, there are positives this week as far as overall, especially here in Florida, but even throughout the United States as far as the overall numbers. But depending on where you are, you could be dealing with a significant surge, and so we do still recommend that you are aware of your surroundings. I can tell you once again. We see people all the time, whether they're traveling or whether they're at home, getting it. There was a study where they polled people and they said, why do you think that people are getting COVID currently? And there was still about 30% of people that were saying that the current increased numbers of COVID are due to foreigners and tourists and immigrants, and that's just not true. So please be aware that the COVID that's spreading is spreading in between good old Americans. So do not make the mistake of feeling like just because you know that person that you are sure that they don't have COVID. And when you're traveling, do make sure that when you are going through these airports and you're being exposed, or any kind of mass events where you're being exposed to a lot of people, you need to assume that the people around you have COVID, and that it is possible for you to get it. So that's all I have for you guys for this week. I hope that you're having a wonderful day. We had a little bit of rain earlier, but we are doing really well. And like I said, we had a lot of fun in our office. Yesterday we had a open house where you guys know I do a lot with sexual wellness, and so we were debuting our new Alma Duo toy. So if you're interested in learning more about that, please visit our website and check it out. And or my you'll see information on that on my YouTube, or my what am I trying to say? On my Instagram or my Facebook page. But anyway, as always, you know that your health is my primary concern, and I hope that you guys have a wonderful weekend. I want you to stay healthy. I want you to stay safe, and I will see you next Friday at 4. Take care.